Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you for the time. It's an honor for us that we can present about our international community service at the International Conference of Community Service 2024. The title is Detection and Prevention of Nutritional Problems Children Under 5 in Taiwan. My name is Titih Huriah. This is my team, Palasipa Anduniarti, Farindira Vesti Ramasari, and Associate Professor Xuan Yuan Xiao from the Department of Sociology, National Chengchi University of Taiwan. Okay, this is the outline of presentation. We have introduction, methods, result, and conclusion. So for the introduction, we know that stunting is a global problem faced by every country and generally indicate poor parenting functioning. The worldwide prevalence of stunting in children under 5 years of age was 22.2%, is equivalent to 150.8 million children. There are 83.6 million stunted children under 5 in Asia, with South Asia having the highest proportion, 58.7%, and Central Asia having the lowest, 0.9%. So in October 2022, data showed that 34% of immigrant laborers in Taiwan is originated from Indonesia, making it that Indonesia is the second largest group behind Vietnam, which accounted 35.5%. So one of the urgent problem for immigrant laborers is the childbearing challenge. Childbearing challenges become more demanding for migrant families since adapting and adjusting to a new culture may stress both parents and children. Stunting is usually an indicator of poor parenting. The role of parent is important for children growth, development, and learning, and therefore this community service aims to detect and educate mothers as migrant workers in Taiwan. So we know that for the child rearing barriers at Indonesian migrant families, they have external and internal barriers. For the external barriers, there are cultural gap, social environment barriers, and then for the internal, they have a language barrier and psychological barriers. So how about the method? The initiation of community service activities involve coordinating with Salimah Taiwan to arrange permission, infrastructure, and participants. The subsequent phase involve the preparation of a module specifically designed to identify and provide education on the issue of stunting among immigrant workers in Taiwan. The training activities will last 2 days. While on the first day, participants will receive instruction on stunting and its prevention. On the second days, the focus will shift to teaching participants how to identify stunting in toddlers. The evaluation of training will use Kirkpatrick method. They are 4 levels. Level 1 is direction, level 2 learning, level 3 is behavior, and level 4 is result. So this is the result. Community service activities we carried out in Taipei for 2 days. On the first day, we targeted Indonesian mothers studying or accompanying their husbands studying in Taiwan. There were 20 participants on the first day. So on the second day, the target was 22 migrant worker mothers who were married to Taiwanese people. So the service activity are carried out using lecture and focus group discussion method. Participants were very active during the discussion because they were rarely exposed to health education. Mother migrant workers state that the information they get is usually seen on online media or YouTube, where they cannot interact directly. Most of the participants on the second day had teenage children, so the issue were more focused on teenage growth and development. There were 42 participants in this service activity, but just 15 mother with toddlers, so only 15 participants filled out the questionnaire. This is the result. The characteristic of participant, most of them is lecture, and then the education is college, and then the age, the mean is 29 years old. So the table 2, we evaluate the knowledge and attitude after training. The table 2 so that the knowledge and attitude also increase after the service community service activities with p-value less than 0.05. So this is our output. We targeted a manuscript. We submitted to ICT-CED from Universitas Muhammadiyah Jakarta, and video. We have a draft of video. Media Massa we submitted, and We also publish and haki. I think that's all for our presentation. Thank you so much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.